term.
First Minister, the reality is accessing even some of the most basic NHS services is a real problem for many of my constituents. Whether it's a GP, a dentist or an ambulance, it is a serious struggle for many people to access services quickly in that area. Of course, it's the Health Board's view that centralising services away from people will improve service delivery, and as you know, I'm firmly against plans that result in people having to travel further for vital and essential services. Now, the Welsh Government can set an agenda that makes it clear that services should be delivered as close to home as possible, and there should be a proactive strategy to invest in hospitals like Withybush Hospital in my constituency. Therefore, First Minister, can you tell us what the Welsh Government is doing to ensure that the Health Board's latest consultation genuinely takes on board the views of the people of Pembrokeshire? And can you also tell us how the Welsh Government is actually investing in services at Withybush Hospital so that people in Pembrokeshire can access vital services as close to home as possible?
Well, thanks very much. And I was able to speak to the Chair and Chief Executive of the Hywel Health Board last week. They are genuinely taking on board, I think, the views of the local community, which is why they're going to push back a bit, because there's been a massive response to that. I do think it's important for us to recognise the amount of the work that is already being done by the Hywel Health Board. And just to give you an example, in March, GPs saw nearly 177,000 patients. Now, that's the equivalent to about 46% of the population. I mean, seriously, there's a lot of work being done here. And I do think also that we have to focus and make sure that we're interested not just in getting services as close as possible to home, obviously, but also clinical outcomes. What will give the best clinical outcomes to people? And that has to be a part of the occasion. I'll just give you another example of the kind of work that's being done in Hywel. 90% of mental health assessments for under 18-year-olds are being done within 28 days of referral. When it comes to over 18-year-olds, 98% of them are being done. Now, that is massive improvement, along with the improvement we've seen for 2-year planned care and outpatient waits of over a year falling by 97% in the last year. I do think that Hywel is starting to turn things around.